Hey everybody, welcome back to Heart, Less Leg, More Heart's peer virtual support group meeting where we bring health and wellness experts and amputee-related subject matter experts to the comfort of your own home to provide you education so you can live your best quality of life and at least know what resources are out there and what education is out there that you may not be getting in the typical clinics that you visit. Today we have an amazing speaker. I say that most times, but I'm really, really excited about today because we're going to be talking about electromagnetic frequencies, which I can tell you hasn't come up in the last several years for me, but I bet it affects me every single day, and I'm excited to lessen my ignorance alongside you guys. We have a really featured speaker, Dr. Don Nixdorf. He's a doctor of chiropractic. He's also the president of Farabloc Development Company. They make an amazing product we're going to hear about later that helps to solve some problems in the amputee space. He's also been a professor at the College of Chiropractics and also has done tons of different media outlets. I also watched some of his TED Talks. I would implore you to look up his name and just Google it and find some of the fascinating work that he's done in his lifetime. So without further ado, Dr. Nixdorf, I'll hand this over to you and I'll pull up the presentation that you have on my side.
Well, thank you, Christina, and thank you for all those that are joining us tonight. I'm looking forward to this presentation. It's despite all the other things Christina said I was doing, I was unable to personally load the PowerPoint. So thanks to Christina and her associates for making this happen. Tonight, I want to talk to you a little bit about two things. One, EMF, what it is and why it's important. And I'm going to assume that everybody on the program tonight is an amputee or knows someone who is an amputee. So we're going to title this Medical Health Benefits. And the important thing to keep in mind as we go through this, talking about the absence of EMF. EMF is electromagnetic fields and frequencies. So everybody who's got a cell phone, computer, laptop, everything, how do they connect to each other? There's no copper wires. It's always Wi-Fi. So EMF has been part of the environment. It's part of the technology we use today, which is obviously wonderful. But 40 years ago, the company of which I'm a part of now made a very significant discovery for biology and sciences. Number one, there's a way to from high EMF. And number two, more importantly, why is it important to shield from high EMF? It turns out that the absence of EMF literally allows tissue to heal faster. And this was demonstrated in two clinical trials, one with horses, race horses, and humans. In both cases, the material, a fabric-like thing, is worn or laid upon, and the results are that the inflammatory markers in the blood test all decrease. So we're going to show this to you as we go along. So Christina, why don't we just go to the first slide here, and we're going to capture people's attention here a bit dramatically. So this is a picture of Tate, and all of this is with the permission of his mother. So I was on another Facebook group, and this young fellow at the time is 14 years old. He has muscular dystrophy, and he had both the legs amputated July of 2024. So on the Facebook group that I was working with, there was the appeal for help from his mother, and the administrator of the Facebook said, hey, there's someone I can introduce you to, and we did. Make a long story short, he has, as I said, muscular dystrophy. His legs were amputated July of 2024. But the other interesting thing was his mother also pointed out he had severe sleep issues because he is autistic as well, diagnosed with autism spectrum. So between autism spectrum, muscular dystrophy, this family has some challenges with this young fellow. After speaking with her, we donated and shipped at our cost 2 limb covers and also a piece of the fabric technology therapy that goes inside the pillowcase. So he started sleeping on this and started wearing the limb covers, I think the day after November 30th, rather. And I spoke with his mother this morning, and she sent me this text that you see on the side. So I'm really, really pleased and thrilled to tell you that since December the 1st to now, he is able to sleep again. And that's because the sleep deprivation from autism spectrum is not an issue anymore. And then also the mother commented on the phantom pains that we're getting in his limbs. When I asked her in the phone calls we would have how he expressed his pain in his limbs, she said he would constantly be screaming and hitting his limbs, that people who experience phantom limb pain regularly know exactly what that's all about. So the autism spectrum, we can talk about that later too. But the other thing that I found really, really interesting, because this has also been reported by several others, in that first part there, she says, we have joked that he is finally turning into a teenager. The great sleep is making him a really happy kid. And this is something we noticed also with people that were sleep deprived, rather, whether it was due to the severe phantom limb pain they get at night, or in the case of Tate here, the sleep deprivation from autism spectrum. So with this sort of setting up the rest of the presentation, I'll take you through some of our statistical things. So if you want to go to the next slide, please, Tina.
Sure.
So we are a British Columbia company manufacturing medical device therapy since 1983. We have a Health Canada establishment license. We're also listed with the FDA under limb cover. And as I mentioned, the company before my time made these two biological important contributions. The fabric, and you'll see a picture of this later, literally shields or blocks the high EMF that our bodies, our environment, and the technology we're exposed to today create. The other important thing was, well, what does it do when you shield the body from high EMF? Well, if you're an amputee experiencing phantom limb pain nightly every night, I'm pleased to say it will relieve or block the phantom limb pains. And of course, we also have a solution for the prosthetic as wearing a prosthetic device you wear too. So clothing, bedding, bandaging with Farabloc fabric has been broadly demonstrated to reduce pain and speed recovery. So let's go to the next one here, and we'll give you some of our statistical information. BC Incorporation, 1983. We've been doing this for 40 years. Life Sciences BC, we're a member of Better Business Bureau, the FDA listing I mentioned, Health Canada. WorkSafe is the compensation board system here in British Columbia. We also are involved with distributors in Taiwan. We're involved with 2 hospitals in the United Kingdom. And we're also, of course, listed with the local authorities as well. So that's just some of the more boring stuff. We're considered a Class 1 medical device. Class 1 medical devices, for the purposes of both FDA and Health Canada, are the lowest classification based on that they produce no harm. Let's go to the next slide, and we'll introduce some of the features here. So here are some of the people that we've provided help for. The hemiparaplegic and your far right or left is obvious there. The one with the long limb, this gentleman was amputated both ankles. And at the time that this picture was done, he had 20 years of phantom limb pain. And we custom made 2 large limb covers for him from where his ankle used to be to above the knee, because people that are below knee amputees, they'll also express problems with their knees. The next one is a person that was in hospital and used the bandaging right after surgery, and you can see the minimal scar, not to mention the absence of phantom pain. The other 2 pictures above each other, this was a gentleman who was a diabetic amputee. They had already amputated the toes of his other foot several years before I was introduced to him. And these 2 pictures were done in the process of his amputation of his second foot. And you can see the necrotic tissue, which they debrided as they went on. And I can tell you that about an hour after we gave him the limb cover for what was his residual foot, he says, Don, he says, my pain is starting to go away. And through the use of the Farabloc and its particular wound healing characteristic, they were able to save the rest of his foot, as in the picture below. Because those people who are amputees due to diabetes, most of you may be aware that their tissue recovery in their feet, toes, ankles is severely compromised by the diabetic state of the neuropathy. So they were able to at least not have to amputate further up. And the other one is a patient of mine. He was busy with his saw in his garage, and of course he decided to trim his finger a little bit too. And he contacted me for phantom pain. So this gives you a range of conditions that amputees experience, their body parts. And I'm pleased to say that because this is a therapy fabric technology, anything you can do with the fabric will take care of an amputee's area, which we'll show you in the next slide. So in the upper picture, this is the example of what we did for the gentleman who had, and we did obviously both legs. The one beside that is a person who was amputated right at the shoulder. And we had some difficulties trying to find a method to keep it on the shoulder. In this particular case, it was a woman, and she was able to take the little clips that you see on the top. We had 3 of them, and she just looped them under the bra strap. But since then, we've become a little smarter, and we let amputees who are above knee, as well as shoulder like this, we let them know that they can simply take the fabric and sew it into the end of their shorts for their undergarments for those that are above knee. And in the case of the shoulders, we had one recently, they bought enough material and they're going to simply sew the fabric into 3 of the person's t-shirts that he's regularly wearing. The bottom one is the person that you saw previously that showed the post-surgery wound care. And here's how they just simply put the cover over top of the bandages. And this person was still in hospital. The middle lower one represents a person with a below knee amputee. And here we make a limb cover that simply covers the limb above the knee. And you're seeing a Velcro-like flap enclosure that they can adjust just for comfort. So when the prosthetic is not being worn, this is the limb cover that allows you to rest and sleep without phantom pain. And of course, for fingers, you see what we were able to sew up for people that are unfortunately have lost a finger due to accident or anything else. So let's go to the next slide. So people always say, well, I don't know what EMF is. So in today's world, this is just one of many different kind of representations that shows you all the things in your life, from airplanes to cell phones, driving through cities, anything in your house that is sending a signal, it's using RF EMF. Today it's called 5G. It used to be called 4G, before that 3G. So the 3, 4, 5Gs is just another way of selling and marketing RF and EMF. It's the signals that connect everything today. So the technology is wonderful, but in the 40 years ago, we found out that the absence of the same technology was equally wonderful. So let's go to the next slide that I'm sure Tina elaborated on. So here's the example of one of our research studies. So if you go to the Farabloc website, all of our research studies can be found and reviewed there. The Department of Physics and the University of British Columbia did the analysis of what our material shielded from, namely the range and the frequencies. So essentially from 1 megahertz higher, and where the effectiveness is most found is in 2, 3, 4 gigahertz. And 2.4 gigahertz, if you look at all your electronic devices, that's what they seem to be all broadcasting at. So this is just an example that the fabric shields, and it shields from RF EMF, and the specific ranges can be identified. Let's go to the next slide. So these are some of the effects from the absence. And you'll hear me use this word absence over and over again. The discussion used to be the last 30 years, don't live under a power line, you'll get cancer. Well, we have no idea if that's true or not. And there's lots of studies at the World Health Organization, universities all over the world that can continue to study the issue of whether EMF is harmful. But they're ignoring that we have empirical evidence for 40 years that there's evidence what happens in the absence of the EMF. And maybe that'll help people construct research trials to help understand if EMF is in fact harmful. So in the absence of this high EMF, there's of course the absence of phantom limb pain, accelerated wound recovery seen in 2 hospital studies, less surgical scar tissue. And of course, this is kind of important for people too, not to see big scars. The sports, the delayed onset muscle soreness that athletes get. Fibromyalgia is really, really interesting. Here we have people that will sleep on a 3x5 sheet of the fabric underneath their fitted or bottom sheet, and their chronic pain of fibromyalgia significantly decreases. And that's, of course, associated with the next one, chronic musculoskeletal arthritic pain. Number 7, the lower brain power. This is where the University of Toronto did a study on 3 brainwaves, and they found that the fabric not only did shield from EMF, but when the brain was shielded from EMF, 3 of the brainwaves they were studying decreased in what they call spectral power. I had to ask him what that meant because I don't deal with that. And he said, just basically the brain relaxed and worked more efficiently. But one of those brainwaves that decreased was also the one associated with deeper sleep. And that's where we then found that people who are diagnosed with autism spectrum and don't sleep well, they wake up multiple times a night. We found that introducing the fabric technology into a sheet inside the pillowcase, guess what? They started to sleep. And diabetic neuropathy, interestingly enough, is also something that improves in people. We have a boot-style apparatus, just like a sock, and it helps the muscle and blood vessels, not the blood itself, but the tissue, start to recover faster. So let's go to the next one. So here's where we had our first study with Dr. Twydale, a retired, now passed away veterinarian. And he was the one that took large sheets, put it over horses, and then found that the inflammation in the blood tests that he was able to do all decreased. It also had a very calming effect on the horses as well. And anywhere where there was wounds in that picture of the horse's leg, we're able to prepare things that would go around the horse's leg and help their performance and heal faster rather. The next slide. What's after the horse there, Tina? Okay, so here's another study. This is the one on fibromyalgia and delayed onset muscle soreness. I won't belabor these things other than to let you know that we're one of the few medical device therapy manufacturers that actually has clinical trials, multiple research trials on all these things that are demonstrated to have benefit from the absence of high EMF. And I should stress again that all of this started in 1983, 84, primarily for amputees and the relief of phantom limb pain, and of course, their wounds healing faster. Let's go to the next one, please. So again, just a little bit more, the fabric itself is 90% nylon, 10% stainless steel. The nylon is simply the fabric that holds the very fine 8-micron stainless steel fibers. Many of you may already be familiar with copper or silver or other things, but those metals will start to decompose because they're subject to more acidity of the bodies and oils. So the fabric here, again, less scar tissue, less pain compared to the placebo group. And for those of you that like to read research, here are some of the blood test markers, all associated with the absence of high EMF. Our next one. The effect of high frequency, this was the study, as I mentioned, on brain waves. They had a Farabloc hood hat style thing, and then the decrease in the spectral power allowed better rest and sleep. So for people that are concerned about the effects on brains, we simply put the fabric inside a baseball cap, and people like wearing baseball caps, so we have a very, very nice blue baseball cap for people. Next one. So here are 3 examples of how the fabric can be used. And it's been used in 2 hospitals in the United Kingdom. And one of our primary research was done at Vidant Hospital. And I can never remember if it's Charlotte, South, or North Carolina. In any event, these are all research studies going back to 2001 on the absence of phantom limb pain. Now, the bottom one shows a pair of shorts where someone who's above knee amputee and the undergarments, they simply have to sew the fabric on the outside of the shorts, cover and sew the bottom shut, and then they don't have to worry about putting anything on or off. Their undergarments are automatically have the material shielded for the end of the limb. The middle one is the person in the hospital. There you'll see how the hospital can simply take the fabric, lay it around the bandages, and that takes care of wounds and pain. The third picture on the far side is what it looks like when the prosthetist takes the fabric and laminates it into the socket. So sockets are laminated. You're probably familiar that use carbon fiber, fiberglass, and the rosins. Well, this is a simple cloth-like fiber. They can just add 2 layers in the lamination, and then when the amputee puts the socket on, they get the relief and absence of the phantom pain when using the socket, and of course, using whatever they need for a limb cover or undergarment when they don't have the socket on. The next picture. This, again, for those of you who want to have the research study, this was done at the Vidant Hospital, and they were measuring the temperature at the wounds to show more data on the effectiveness of wearing the fabric on the wounds, and they had a marked temperature decrease, which is also associated with less inflammation. If there's less inflammation, less tissue damage, more normal temperature, less pain, faster healing. And the next one, please. So here's that gentleman in the hospital again. It's actually a personal friend of mine. And you see the stages of the wound after surgery and a nice, clean surgical recovery. And you see how he used the cover over the below knee, in this case at the hospital. The next one, please. So this one I'm just showing you to show you the different stages that someone who had quadriceps surgery done, and they used the fabric over the wounds with the end result to show much less scar tissue. And of course, he had less pain during this as well. The next one, please. This person, again, we're showing you this, how the material can be applied. It's gray, and the white is the bandage. The gray was just the cloth over top of the bandage. The person has 2nd to 3rd degree burns from scalding water pouring over their thigh, and they have absolutely no evidence of any skin damage today, years after it healed. And this is another, how simple it is to use. This was the earlier case I referred to. Pictures are rather nasty, diabetic amputee, and it shows you the stages of wound healing. And because he was diabetic amputee, it took several months to recover. But as he said, it was half the length of months that it took compared to his other foot they amputated, and notably much less pain within hours of us providing the cover over his toes when we first met him. These are all patients that I've treated. Now, one of the other interesting things, we'll cover a few more things here. Now, again, remember, we started this in 1983 to relieve amputees of chronic pain and wound care. But over the years, we discovered other things that were also researched, a lot of them initially from observations and then research and then constant use. We found that not only fibromyalgia, delayed onset muscle soreness, phantom limb pain, then we found out that women who would get 2 or 3 hot flashes every single night. And some of you may or may not know what this is. For the men on the program tonight, if a woman waves at you, don't assume she's waving at you. She's just fanning herself to get more cool. So here we know empirically from users and a research trial published, a woman 7 nights a week, having 3 or more hot flushes every single night, 80% of the women had 0 to 1 and could sleep faster. So this was another feature of what happens from the absence of high EMF. Let's go further. This is just a quick example that shows you the sheet is 3 by 5. It's placed under the fitted or bottom sheet. That's the one that goes away for washing. Let's go to the next slide. This is a picture of a pillow, and the gray material is approximately 20 inches by 20 inches inserted into the pillow on the top of the pillow, but under the pillow slip. And this is where we're finding that the people that are not able to sleep due to a diagnosis of autism spectrum begin to sleep by the 2nd night. And here's the next picture, please. So this is actually a magnification of the fabric itself. The sort of gray, abundant gray fabric, those are the very fine nylon, and those little fine dark lines, that's the 8-micron stainless steel fibers. So that shows you how it's woven together. We get all our material from Atlanta, Georgia, who sources a couple of weavers in the United States. They source the nylon, I'm not sure where, but the stainless steel fibers are a very specialized product coming either from France, Belgium. We're not sure about China, but personally, I'd rather they all come from the United States anyway. But this is actually what the fabric looked like. So I'm going to make a rather bold statement. And so far, my 20 years of experience, patients, research, and wounds, and otherwise, we can end the pain of phantom limb pain. We can end phantom limb pain, if not 95%, probably 90%. How do we do it? By putting that fabric to hospitals, or when the patient goes home, just put the fabric on top of the bandaging after surgery. This was shown effectively at Vidant Hospital, as I mentioned earlier. The second inclusion is in the prosthetic sockets. This is very cheap fabric, and they just have to laminate it into the socket, and it's a permanency in the one socket or the subsequent sockets that are made. The third one, of course, is limb covers. This would slide over an arm or a leg, above knee, above elbow, below elbow. And the fabric is very comfortable to wear. It's just like a piece of gray linen. And for people that are experienced, not everybody has terrible phantom limb pain, but for those people who are not able to sleep with 3 or 4 shots of acute pain every single night, you will begin to sleep again. And the fourth one, I think, is adaptive clothing. So that's for the people who are above knee or any kind of undergarments, or people that are hemiplegic or hemipelvic amputees or at the shoulder. The fabric can simply be sewn under or on top of, depending on your fashion tastes. So this is durable material. It doesn't wear out. People buy it once. And for people that use the limb covers or the sheets, they just wash it just like everything else. And let's go to our last slide. So here's where we started. Young Tate, age 14. He's very happy. And like his mother says, he's becoming a teenager. He's sleeping, he's laughing, he's happy. And I know that that's partially because of his ability to sleep due to the absence of the autism-induced lack of sleep. But he's now getting zero phantom pain. And if any of you yourselves or someone you know has phantom pain, this is a pretty dramatic example of a 14-year-old with muscular dystrophy having lost his limbs due to muscular dystrophy. But I'm so pleased that we're able to improve some quality of life for him and certainly his family as well, I'm sure. And that takes us to the end. And I thank you very much for your patience with my technological mistakes today. I'll try to figure out what the heck happened here.
It's
Christine,
all good.
I can't thank you enough for the opportunity to present this, and I hope this
Yes.
makes a difference to some of your listeners' lives or somebody they know. And I'm happy to be on for any questions at any time or anything at all.
Yes, I'll open it up to the group and certainly Z if there's anything in the chat that you want to read through. But my biggest question is, and I was telling the group just before you came back on, I was an amputating clinician and also have been an amputee for 8 years. And I heard about your product last year from Gary Wieland, and it still seems to be sort of a word of mouth thing. And so my big question to you, because it's so frustrating seeing all these people suffering from this condition, but with having a non-invasive, non-drug eluting, cheap fabric, what do you think the barrier is to this being common practice for post-op and prosthetic care?
I think you gave half the answer in your question. It's non-invasive, it's non-drug. And for those of you who are religious, I'm going to apologize. This could be the shroud of Jesus and nobody would care. It's a piece of cloth. It's not a needle. It's not a pill. It's not a knife. It's not electrical implant. It's not electrical anything. It's literally a piece of cloth. And I've given this talk many, many times over the last 15, 20 years. And Christina's question is the one that always is asked. How come it's not known? Well, partially because we don't have enough resources, translates to money, to do a marketing campaign, find people who have had an amputation, ask them if they want to be ambassadors to be associated with the company. I can tell you right now, I'm communicating with a hospital in Germany and a hospital in the Ukraine because we did help wounded soldiers, Ukrainian soldiers, when Russia invaded Crimea, and we have pictures of the amputees there. So there's 2 hospitals in the United Kingdom. Well, I can tell you there's more than 2 hospitals in the United Kingdom, but only one shut down because of whatever reasons. But the other one is actively using our material. They order it twice a year for 7 years. But here's the interesting point to Christina's comment. It's the only hospital in England. So as to why this is not better known, A, it's not a pill, needle, drug, or knife. B, we're looking for partners and resources to help introduce this to hospitals. Like, why wouldn't a hospital wound care clinic have this as automatic bandaging? Well, half of them still don't understand the significance of EMF. Admittedly, that's always a challenge. So we have to constantly find ways, and this is why some of these pictures in this presentation are intentionally dramatic. The more dramatic pictures we can find, the more people will take an interest, maybe the more they will talk. And our company, we're always open to finding or identifying and helping people who are in severe need. We will donate it to help them. The only thing we ask is they help inform others of what this is. So I am confident that we're going to make a broader impact. I just don't know if it's going to be in 3 months or 10 years.
Yeah, no, it's just so relieving to have options. And I will talk and connect with you, Dr. Nixdorf. I have got some good ideas and some good opportunities. But I also wanted to ask, what is the cost level? Like if a user is watching this and they go, I definitely want this, do they go to the website to purchase? Is it something they have to purchase through their doctor? And if they purchase themselves, what kind of price range are they sort of preparing themselves for?
Sure. All purchases are direct to us. All purchases are online, or you phone me or you email me and I help you out whatever you need. So let's take someone who's got a above knee, below knee amputee, and they're going to use a limb cover. It's going to be about 200 Canadian dollars. Now that take about 30% off of that. So that gets you one limb cover. If you have special needs, we're gonna make arrangements for you. It's a one-time purchase. It's washable. And if you're wanting to get fabric to sew into your own undergarments or your own t-shirt or whatever, we can do that for, I'm going to say about maybe 70, 80 Canadian dollars, depending on how much fabric you want.
Yeah.
So you don't need a referral. I always get asked if in the United States if it's covered by insurance. It's a good question. Everybody has to take a look at their own insurance program and look for something that is called bandaging, limb support, something that, you could even call it a dressing, a limb cover or bandaging or a limb support. The insurance companies use generic language, but we do have FDA listing, and we can help out with our FDA registration code if that's required to recover costs. So let's say you're going to want some fabric for your prosthetist to laminate it in the sheet. It's going to cost maybe about 80 Canadian dollars. So all these numbers are Canadian dollars, which right now you get a great benefit from, with the US dollar conversion being roughly 30% less US dollars. And the tariffs between Canada and Trump, I don't think are going to make any difference whatsoever, at least what we're talking about.
Oh,
So,
good. Well, I mean, really cheap we have a lot of products that we've featured and discussed. And if anybody is thinking about products and Phantom Limb, you can look at our Phantom Limb YouTube video, where we did also mention Farabloc. But the other opportunities, the other goods are significantly more expensive compared to what this price range is, which is really exciting. So if there's any amputees on this call or watching this back on any of our channels and you're interested in getting this and you have any kind of financial barriers, you can just go to our website, Amputee in Need, and let us know, and we'd be happy to help you so that you don't have that financial restriction. My other question too is, as it pertains to EMF, and just to circle back on some of the pathophysiology a little bit for folks that could just be tuning in late. EMF, is, first of all, one of our chat members said, are 5G smartphones bad in terms of their impact? And then the second fold of that is, how does EMF directly affect the tissue? Like, we inferred that the CPK levels are reduced, and that the global inflammatory markers are reduced, and so it looks to be at some kind of a cellular level. But can you speak to that direct correlation, if there is any?
Yeah, I can. So first of all, this area gets a little bit about my expertise, but fortunately we've worked with 6 or 7 different physicians and at least 3 hospitals and researchers. So what the researchers so far have told us is that EMF is kind of like laser. So laser and EMF, they both are wavelengths and frequencies. So EMF specifically is a range of wavelengths and frequencies from your electricity outlet of your house all the way up to an X-ray machine. So those are examples of wavelengths and frequencies. So what it appears to do is that when you see that the tissue is healing faster, when you notice that the blood test markers have all decreased, that happens because at the cellular level, if we all go back to our grade 9 science class, we learned that the body is made of cells. The cells have membranes, and there's this plus and minus polarity, neutron, proton, electron thing going on. So the cells of our body are subject to what is called permeability and the influence of sodium-potassium channel. So sodium-calcium channel. So the EMF is able to affect the polarity of the cell structure through the plus and minus balance. So the cell virtually heals faster at the cellular level, and that's why we see these very accelerated recoveries, less pain, less inflammation, less swelling. When you have less pain, less swelling, less inflammation, and tissue repair, only one thing happened. The cell at the cellular level membrane healed faster. So it appears that the influence of EMF affects what is called the polarity of the cells. And you can, if you look up calcium channel blockers and cell polarity, then you'll start to go down that rabbit hole of EMF, and I fall asleep when I do that. So
Which you probably do well because you have the sheet under your pillow.
Yeah, see, there's one other thing when you were mentioning cost, I would venture that every amputee who suffers is buying medications on a regular basis or other supplements to mitigate their pain. On our website, we have the testimonial Phantom Limb Pain. You'll see the gentleman then, Sean Trahan, and his 1 year post Farabloc use. he had to go through addiction withdrawal of his opioid medications after 14 years because he no longer had the phantom limb pain, but he couldn't get off the medication that he was previously using for the phantom pain. So you get a one-time cost for the fabric, but then you also, if you're going to get help and you're also on these drugs, you're going to eventually save money getting off of all your medication. But if you become addicted over 4, 5, 10 or more years because of the chronic pain, be prepared to get off of on addiction recovery control program,
Yeah, no,
which is
great,
good, by the way.
great comment. There's someone in the chat that asked about our bodies, if they create measurable energies like magnetic fields, and how that sort of interferes with things.
Yes, they do, but they do it at such a minute micro level that it doesn't interfere. And I'll make reference to transmagnetic therapy, where for Down's conditions, they are doing trials and experiments where they measure and monitor the magnetic field of the brain. It's such a minute level that it has no impact on the treatment and therapy of Farabloc one way or the other. And if we go back to that study at the University of Toronto, where they did the measurement of the 3 brain waves, we found that by shielding the body through a hood hat configuration, your brain literally relaxed more. But yes, in short, there is a very, very minute measured electromagnetic field the body does from its own electrical sodium-potassium interchange.
Nice. And then I always want to think about the implication of this, right? Because at this point, I want to sort of TP my whole house with this product. I don't know if anyone else here is like, I just want to roll around in it. When you think about the functional changes, aside from laminating into the leg and, you know, having the sheets that you showed, do you keep your EMF emitting devices in different rooms? Are there different types of lifestyle modifications that people can make to reduce their impact as well as the product?
I don't think they make a difference. And I say that for 2 reasons. First of all, remember the EMF we're talking about is ambient, meaning planetary, not man-made. It's part of our natural environment. People describe that's how birds navigate their way around the planet. They follow the magnetic fields, not just the wind patterns. We also know that when the ubiquitous smart meters came out to read power consumption in people's homes, people were trying to wrap things around their smart meters, their walls, or everything else. It turns out that the EMF protection, first of all, doesn't have to come from any one direction. So when people lay on it on a flat sheet or you wrap it around your limb, the reason you wrap it around the limb is so when you stand up, it doesn't fall off. So here's the point. EMF is multi-directional, all directions, 360-degree directions. So the benefit comes from shielding the body from any single direction, and it has to be what we call proximal near the body. It does not have to touch the skin, but it doesn't work putting it 3 feet away from you, hanging on the wall, or covering your TV or your modem or your cell phone. No, it turns out that the high electromagnetic field blockages have to be close to, near, or on the body. But again, it does not have to touch the skin. It just has to be part of your clothing or you lay on it. So painting your house, hanging it on your drapes, or putting on the shingles on there, you're probably wasting money.
Thank you for that, because I would have done that. Any other questions for the group? Is there anybody else? I know that you guys have already entered into the chat, but is there anyone else here that has any comment, question, or concern for Dr. Nixdorf? Yeah, go ahead. Go ahead, Kim.
No, I don't necessarily have like major phantom pain, but what I have feels more like tingling, zapping, that kind of thing. Is that kind of along the same lines of?
Yeah, what have you got? Below knee, amputee, or above
Below
knee?
the knee. I'm below the knee.
And just one leg, right?
Yeah, just one leg.
So we would expect, and you have this every day to some degree?
To some degree, it feels like I have restless leg syndrome all the time.
We would expect you to find relief in the first 2 or 3 nights. That's something else I forgot to mention earlier. All of the applications and therapies we provide in whatever configuration, if the person is going to find help, and I can't say that 100% of people find 100% of the time, but over 80% of the people get relief. But the notable thing about the relief from the therapy, it begins in the first 2 to 3 nights. Like, you don't have to wait 2 weeks to find out if this fabric technology is going to help you. If it helps, everyone who gets help starts to report it in the first 2 or 3 nights, whether it was phantom limb pain, pain from surgery, hot flashes, someone who's experiencing something 7 days a week, multiple times a day, they begin to feel the relief starting in the first 2 to 3 days and nights.
Well, I am I am in menopause, so that sounds very fascinating because I'm sitting here having a hot flash.
Well, I'll tell you what, if you're having, how many hot flashes do you have every night, and do you have them 7 nights a week?
Oh yeah, I wake up at some point in the middle of the night and I'm like all just sweaty and everything. And sometimes I'm so sweaty I got to change a shirt or whatever,
How many,
the pillow.
how many
I'd
times?
say at least 2, maybe 3 times a night. I'm sweating, and then I get cold, but then it's like back and forth, back and forth.
Now, is this 7 nights a week?
Yes.
Okay, I'll send you complimentary a 3x5 sheet. If it doesn't work, just send it back.
Well, thank you. I appreciate that.
And of course, if it works, then I'll give you a big discount anyway.
You know, my favorite people making solutions on the market are people that just run business the right way and just really are there to help people. And I hope, Dr. Nixdorf, that you being here to share your information and us sharing this with our large cohort of amputees and putting it on our channels helps other people find these solutions that are cheap and, you know, less damaging than the medications and the interventions that they're undergoing, because it's just really hopeful. So I really appreciate your time and your knowledge in being here. And I will certainly send you all the links after this. And folks, if you're out there and you meet an amputee and you know somebody that's struggling with any of the conditions that we talked about, make sure you share the information, because that's how all these businesses that are being beat out by these larger pharma companies get to be known. And so certainly help us in spreading the word. But thank you again, Dr. Nixdorf.
Well, Tina, thank you. And thank you to everybody that was
Thank you.
patience to join us tonight. And, you know, Tina and everybody listening, if you have any thoughts or you want to involve yourselves in some way, if you have ideas about how you'd like to get involved in some way, I'm only too happy to talk about that anytime. Thank you very much.
Thank
Sounds great.
you.
Until next time, all. Thank you.
All the best.